If you're soon turning 65, one of the biggest and most important decisions that you first have to make is whether you're going to go with original Medicare and a Medicare Supplement Plan, also known as a Medigap plan, or if you're going to choose Medicare Advantage. Luckily, that's the topic of today's video. Hi there, my name is Sarah, and I'm here today with iHealthBrokers, and we are licensed health insurance brokers. So if you have questions about Medicare, Medicare Advantage, or any type of health insurance, please feel free to send us a message, or you can give us a call at 888-410-0344. We're licensed nationwide and there is no charge for our services. And of course, to make sure that you're up to date, make sure to subscribe to stay on top of your Medicare coverage, and make sure to like this video so we can get this information out there. And if you'd like, you can find us not only on YouTube, but on Facebook, Instagram, TikTok, and Twitter at iHealthBrokers. So today we're going to be focusing on the differences between Medicare Advantage or Medicare Supplement plans and why either might be right for you. Medicare Supplement plans are also known as Medigap plans. They work with original Medicare and they fill in the financial gaps of original Medicare. They're not going to offer any additional benefits, but they will help you financially. You can think of it like an all-inclusive vacation. You'll pay more upfront to cover additional costs, so you have a better idea of what your yearly medical spending might be. Also, with a Medicare Supplement plan, you'll still have access to that extremely broad original Medicare network. And as an additional benefit, comparison shopping with Medigap plans is very easy because regardless of which carrier you choose, the benefits will be exactly the same. And if your doctor accepts Medicare, they accept your supplement plan regardless of who your carrier is. Now, Medicare Advantage is a little bit different. The plans are not standardized and benefits can vary widely. They're actually much more similar to the employer group health plans that you've had in the past. Some plans may work wonderfully for you, others maybe not so much. So the benefits can vary widely, and very often Medicare Advantage plans, also known as Part C plans or managed care plans, very often they'll offer additional benefits not offered by original Medicare. For example, they could offer dental, vision, prescription drugs, and more, and we'll get into that later in the video. Now, with Medicare Advantage, unfortunately, you are going to have to give up access to that extremely broad original Medicare network. It's going to be highly dependent upon your carrier and the network of doctors and hospitals which accepts your plan. With Medicare, as with any type of health insurance, there really is no one-size-fits-all answer. It depends upon your specific needs. So why should you choose a Medicare Supplement plan? Well, as I said before, Medicare Supplement plans work in conjunction with original Medicare. And original Medicare is going to cover many, if not most, of your medical needs. For example, original Medicare will help to cover inpatient procedures in a hospital. They'll help to cover your doctor's visits, any type of mental health, durable medical equipment, and skilled nursing facility care, as well as many other benefits. Now, even though the laundry list of benefits covered by original Medicare is quite long, there are still some financial obligations on your side. For example, there are deductibles to meet and copays or coinsurance that you'll be responsible for. Medigap plans or supplement plans step in to cover some of these financial gaps, like the deductible and the copays and coinsurance. So if you're someone who feels comfortable paying an additional monthly premium in return for a little bit of peace of mind, then a Medicare Supplement plan may be the route for you. Also, as I mentioned earlier, with Medicare Supplement plans, you still have access to that extremely broad original Medicare network. So if your doctor or hospital accepts Medicare, and most do, then you can utilize that hospital or visit that doctor. So if you're somebody that wants to utilize hospitals and doctors really without any restriction, then a Medicare Supplement plan is the way to go. Finally, with Medicare Supplement plans, there's a lot more flexibility. You're not required to have referrals for specialists or a primary care physician. So if you're somebody that wants flexibility, then again, a Medigap plan would be your best option. Now, in all honesty, most of our clients choose Medicare Supplement plans. So why would you choose a Medicare Advantage plan? Well, Medicare Advantage plans must offer you at least all of the same benefits as original Medicare. But many Medicare Advantage plans are, of course, going to offer additional benefits. Things like vision, hearing, prescription drug coverage, dental, and many more benefits. So that can certainly be very appealing. They're also going to impose an out-of-pocket maximum, which you wouldn't have with original Medicare alone. And very often, these Medicare Advantage plans will do so at no additional charge. You will still need to keep paying for your Medicare Part B, so even if a plan claims that it's free, that's not exactly so, but some plans will even offer you a rebate back towards your Medicare Part B. But I don't want to paint an unrealistic portrait of Medicare Advantage plans. There can definitely be downsides. For example, the restrictive networks. With Medicare Advantage, you are beholden to a network. And if your doctor or hospital doesn't accept your plan, then you won't be able to visit that hospital or utilize that doctor. And in some cases, the plans can have networks that are way too restrictive, causing people to have to travel or not be able to find doctors and hospitals that accept their plan, which is obviously far from ideal. Additionally, Medicare Advantage plans do have an out-of-pocket maximum, which is definitely a very good thing. Original Medicare does not have an out-of-pocket maximum, so if you incur major medical bills, then there is no cap on your yearly medical spending. Medicare Advantage plans do have an out-of-pocket maximum. However, it's going to reset every year. So if you need treatment for something that's ongoing, perhaps something like cancer, and you've reached the end of your calendar year, well, that out-of-pocket maximum is going to reset, which could make things a little bit more financially tight. In addition to the financial benefits that I mentioned a few moments ago, there are other groups of people who may want to strongly consider a Medicare Advantage plan. For example, if you're eligible for a D-SNP or a C-SNP, then a Medicare Advantage plan may work really well for you. These are special needs plans. So a D-SNP is a dual eligibility special needs plan. Basically, it's for someone who's eligible for Medicaid and Medicare. You'll have access to the full benefits of Medicare, plus the full benefits of Medicaid, and many other benefits as well, often with very low premiums. So if you're somebody who is dually eligible, you're eligible for a D-SNP, you may want to strongly consider this option. Then there are C-SNPs. C-SNPs are another type of Medicare Advantage plan, and they are for chronic conditions. If you have one of several chronic conditions and it is quite a long list of qualifying conditions, then you may be eligible for a C-SNP. These type of Medicare Advantage plans are actually specifically tailored to meet the needs of that condition. For example, if you qualify for a C-SNP because you have diabetes, your plan may offer very low-cost insulin and a wide range of podiatrists with low copays. Or if you have some type of heart disease which qualifies you, then your plan may have a wide network of pulmonologists and cardiologists with very low copays. Finally, a Medicare Advantage plan may be for you if you live in certain areas of the country. As I said earlier, Medicare Advantage plans can offer major cost savings. However, the downside is, of course, that network. But in certain areas of the country, there are many Medicare Advantage plans to choose from and many doctors and hospitals who accept a variety of plans. For example, Medicare Advantage plans are very popular in Florida. However, in other areas of the country, Medicare Supplement plans are much more popular. If you are interested in a Medicare Advantage plan, please consider working with a broker who is a third-party liaison who works for you, not the insurance company. And remember that if you decide to go with a Medicare Advantage plan, that you still have 1 year from when you enroll in a Medicare Advantage plan for the first time. This is considered your trial right period. So during this time, you can leave a Medicare Advantage plan and switch back to original Medicare with Medigap. If you liked today's video, as always, please make sure to click like, give us that thumbs up, and make sure to subscribe. That way you can stay up to date. Now, if you have any questions whatsoever about your Medicare coverage, or if there's anything you feel like we left out of this video, or a video you'd like to see, you can let us know in the comments below. And you can always give us a call at iHealthBrokers at 888-410-0344. There is absolutely no charge for our services, and we are licensed nationwide. Thank you so much. Have a wonderful day. Bye-bye.